Hey Jess, so as today is wrapping up, I just kind of wanted to give some insight and talk with you about Beth's rehab today and see how you feel it went. Kind of get some insight on what you're thinking, where you should go from here, or clear up any questions or anything you had about today. I think you did really great today. I noticed that you are increasing the difficulty of her rehab, which I really think is a great skill to have. Making those clinical judgments that you noticed that she is getting pretty good at one thing, but we need to increase the difficulty. You were able to, pick up something really quick and be like, hey, you're really good at this, and let's increase your difficulty a little bit by adding something else or changing it up a bit, not only so they don't get bored, but so they know that they are getting pretty good at one thing, but we need to keep improving. Doing that clinical judgment is a great skill to have as an athletic training student and a young clinician. So I think you are really evolving that skill, and I want to see you keep continuing to do that. So make sure we, keep improving those skills. You're doing great. Something that I also noticed that I really like you did today was giving the patient a scale, a generalized scale, 0 to 50, 50 being playing tomorrow, kind of giving her some insight and giving you some insight on how she's feeling. We see that she is improving, but how is she feeling about her improvement? And I think her response was pretty great, that we are able to see, okay, we're about 20%. Let's see how we can get to 30 next week. Or just, making those improvements every day. I think it really builds a strong clinician and patient relationship, which you are forming. So I think that's a great job. Some things that I really want you to work on this week and in the coming weeks is changing your terminology a little bit. I think we get caught up in using the term for an injured leg bad or an injured body part. Instead of saying bad, that kind of gives it a negative connotation, and I think that it kind of makes it I think that the negative connotation kind of carries with them, as even if they are cleared for sport, or as they continue through the rehabs or anything, they're saying, oh, I have a bad knee, and I think that just gives it a negative connotation. It's not necessarily bad, it's just, it's going through some injury, but we're going to try and get it back to, if not the same, or close to the same as it was before. So I think that's a really good skill that we can work on, is making sure that we're changing our connotation a little bit to say not just bad, but, the injured leg, or, the specific, so say her right leg or something. Another thing that I think would be beneficial to this rehab, but also some other rehabs, would be demonstrating exercises. As we're improving and we're increasing the difficulty, sometimes the patient can get kind of confused. So I think a good way to keep continuing to formulate that patient-clinician relationship is by demonstrating the exercise with them or doing it with them. I think, specifically with the squats today, I know that she had some difficulty understanding, and you corrected her, and it was great. I like that you're making those corrections. But, sometimes the patients, they don't really understand. So I think by demonstrating, or, just literally going through it with them and being like, here's where I want you to be, like, stay within this plane, I think that would be really beneficial, especially to not only improve the way she's doing it, but it can also improve her time. She's making sure within the 30 minutes that she's here, she's getting hands-on, uninterrupted time with her clinician, you being her clinician student at the time. She's able to know that you are paying full attention to her, and you're going to correct anything, and she's going to get the most out of her time, which is going to keep continuing to make her want to come back. One last thing I really want to work on this week specifically is, I know it can be difficult because, we are in this day and age, but really staying off our phones. We have a rule in the training room, no phones, and I think it not only mirrors what you're doing, but the patients mirror what you're doing. So if you're on your phone, and they're going to be on their phone, and we only see our patients for about 30 minutes to an hour a day, and we really want to optimize our treatment time. So by staying off our phone and having that uninterrupted treatment time really can be beneficial, not only to us and to you as the student that you are learning, you are able to get all the information in and experience that, you feel comfortable with, and that you need to not only graduate, but to improve as a clinician. It also shows the patient that we are there for uninterrupted time. We can designate this much time in our day to making sure that we improve anything that you're coming in for, and make sure that we really are narrowing in on your time here. So I think that's a really good goal we can set for ourselves. Just to recap today, I think you're doing a really great job. I think that your clinician skills are improving so great, and I think that you are making great clinical decisions. I think we need to keep improving, so by demonstrating these clinical skills that you are making improvements, I think sometimes patients can get confused, so helping demonstrate that, making sure that we give them uninterrupted time, so staying off our phones, just kind of, when she's gone, sure, you can check your phone, but I really think it's in the time that we have with our patients, we need to give them uninterrupted attention. And also making sure that we are trying to change our terminology from saying the injured instead of saying the bad or giving it a negative connotation. So overall, I think today went really well. I think you are progressing greatly as a student, and I want to see you keep improving. And these are some small fixes I think you could nail right on the head for next week even. So let's continuing to keep doing a great job, keep striving, keep making these great clinical judgments. But here's just a few things, I think we can work on and continue to keep improving over the next few weeks for sure.